So, before we get the sperm out to the baby making section, they have to get out, right? So, ejaculation is the technical term for the ejection of the sperm from the body. They're not strong enough swimmers that they can swim out by themselves. They get shot out at high speeds, okay? And so, before that, the body has to put together all the things that are going to be required for the sperm. Sperm, as I mentioned earlier, they come up from the testes to the head of the urethra through the vas deferens. And then, once they're ready, they are released into the urethra to be out to the rest, out of the body, right? So seminal vesicles and the prostate gland and the bulbourethral glands, those are the ones adding all those cool chemicals, the antibiotics, um, the pH changing chemicals. I think they even have some sugar in there. Just crazy amount of good stuff, all ready to keep the sperm fluid ready to go inside the woman's body. Now, the important thing is just before all of this happens, so obviously sexual excitement is happening in the man to get all of this started. And so before ejaculation, a small amount of liquid is released. The technical name is precum, although I can hear you're giggling from here. That's a very important liquid. It's it's slippery, slimy liquid, and the whole point of it is it's lubricating the urethra. Now remember, the urethra's main job is to carry pee from the bladder out of the body. And rather than create a completely different set of ejection tubes to get the sperm out, they reuse the same exit strategy as the pee does. However, what that means is that the urethra is coated in urine most of the time. And that's not friendly to sperm. And it's kind of gross, right? The man could have a urinary tract infection, he could have a bladder infection, there could be bacteria up in there. And so what happens before the sperm come out is that the body sends out the little cleaning liquids. So it comes through the urethra, coats it, makes it nice and slippery, slimy, all ready for the sperm. It cancels out the acidity of the acidic urine, and it gets everything ready to go. Now this pre-cum can contain a small amount of sperm. And this is why you hear people saying, but I never came. How can she be pregnant, right? Well, pre-cum can contain sperm. So it can impregnate someone. Know that. All right, so what happens with the penis? Now, I actually have had several students ask me in the past, is the penis a muscle? That's a really good question. There are thin muscles around it, but generally speaking, that's not what's happening. It's not this one big hard muscle like um, you get your guns ready and you show somebody your arm muscles and they get all strong and hard. That's not what's happening here. There's two cavities called the corpus cavernosum and the corpus spongiosum. The spongy cavity and the cavern, the cave looking like cavern corpus. And so the urethra runs through the middle of this. So here's a picture. I'll talk about this in a minute. So when stimulated or sexually aroused, both of these corpuses fill with blood. So it's like a giant blood sponge. That's what's inside a penis. It's not a big muscle. It's two different kinds of blood sponges. Now, isn't that kind of fun? So once stimulation is sufficient, the sympathetic nervous system causes peristaltic contractions of the smooth muscles inside the male body. So that closes the urethra off to urine. Okay, we wanted to have that shut, right? Just like you don't want to start breathing while you're drinking water, you also don't want to be having pee come out when you're ejaculating. That would be bad. And so the pee area gets shut off, and all of the seminal fluid is pushed out during ejaculation. And this feeling of pushing all that stuff out is the orgasm feeling. And so you have these feelings that feel good in the male brain because your body's rewarding you. Good job, continuing the human race, excellent. So here you have a picture of the corpus spongiosum and the corpus cavernosum. So as you can see, when the penis is flaccid or flat, all right, all of these kind of the tissue is thicker than the holes that carry the blood. There's some veins and arteries, and there's the urethra, and that's where the sperm comes out right there. But when the penis is erect, it doesn't change in actual physical size, it just inflates. If you can think of it like a balloon, it inflates with blood. And it goes, whoop, and it's all ready to go. So while we're talking about the male hormone cycle, it's important to note that men do have a hormonal cycle. It's not the same kind of thing as women. So if men talk about women always getting hormonal, men get hormonal too. It's a little bit different. So on a day-to-day cycle, men actually have, young men especially, have a very strong change in the amount of testosterone they have in their body at any particular time. So at the lowest part of the cycle, if you look at the top right picture, the lowest part of the cycle is starting about 8 o'clock till about 3 or 4 a.m. That's the lowest part of the cycle. That's the time of the day when the man is least likely to want to have sex. His testosterone levels are the lowest. He's generally going to want to sleep, okay? That's normal. However, if you notice that this change, if you look at the young man section, it spikes so that about 8 a.m., that is the highest level of testosterone. This means this completely explains the so-called morning woody. Men wake up ready to go and make babies. Why is that? Because their testosterone level has spiked really high and their body is ready to get that baby making going. And throughout the day, it goes and goes and goes down until again around 8 o'clock, it's at minimal low. Man just wants to sit in front of the TV and relax, okay? Now, this is true for young men. Old men, pretty much not so much. They kind of have a little bit of a bump here and there, a little bit of a rise, a little bit of fall, but just generally speaking, no. They're not getting much going on at any time of the day or night. Now, if you look at the bottom left section here, you see that a man's hormonal cycle changes over the course of the year. So January, February, that's with the J and the F. January, February, March, April, May, June, July, all the way to December. So a man has the highest level of testosterone around October. And September, October, November. And so if you want to think about the sports schedule, when do all of the most heavy testosterone sports like football, when do those suckers start? They start in the fall because that is when men's hormones are the strongest. The most aggressive, the most, the testosterone is the aggression hormone, and they are most baby making. This is why if you count backwards from the summer, which is when most people's birthdays are in the summer, most of them were conceived in the fall. Most people are conceived in the fall because that is, generally speaking, when men want to make babies the most. Okay? It can happen, of course, any time of the year, but the lowest part of the cycle is in March, April, May. And this is important for men to know because it can be very common for men to feel emotionally depressed when their testosterone levels are at their lowest. March, April, May are the lowest times of the year for testosterone, which means that men are most likely to feel the least amount of aggression, the least amount of desire to make a baby. All of those things that testosterone does, that's the lowest. So this is important for men to know because this is going to affect every part of your life and you don't even realize that you're being affected by your hormones. Just like women may not realize that they are looking to make a baby because they're, fertile. Same thing for men. Now let's talk about the end of the cycle. Now, like I said, men are usually able to continue making sperm until the end of their lives. However, there is a point at which male hormones begin to decline with age. And so even if they're continuing to making sperm, they might not be making enough sperm, or the sperm themselves may no longer be a viable, healthy sperm. They might come out with broken tails or just not able to swim fast enough, etc. And so the term for that time that's happening is called andropause. Okay, so the hormone levels are declining during andropause, but like I said, it may still be possible for men to produce viable sperm. However, there is a biological response and factor to the fact that men can no longer have the same levels of male hormones as before. So here's a picture that notes, okay, so talk about age 20. Age 20, if you look at the bottom here, age 20 to 39, obviously before age 20, you're going to have massive hormonal changes when men first hit puberty. So we're not talking about the puberty kind of, rodeo that's going on there. So once that has settled down, this is your normal kind of progression for hormones. So you see age 20 to 39, you still have a very high level of testosterone. That's why testosterone is way up at the top here. You have fairly low levels of estrogen, luteinizing hormone, and follicle stimulating hormone. And that's okay. They're fine. They are still doing their job. They're still producing sperm. So they're not at a bad level there. Now, as you continue on, you have testosterone start getting lowered. You have a little blip here. This blip probably explains the midlife cycle craziness that you see with some men where they go off and get a new wife and a new hot rod and a new blah, 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 right? The midlife crisis time. That's probably due to this little bump right here, the testosterone bump. Men trying to reclaim the feeling of youth because they've got all this little surge of testosterone going on. And then that starts to fall off steeply. So we're talking like crashing down hard, steep kind of crash. And so by the time you hit your end of your 50s, your 60s, men are seeing almost a completely null kind of area of testosterone. There's still enough testosterone to get up in the morning, to do your chores, to, do what you need to do, but you have less aggression, less, you know, desire to conquer the world kind of thing, because that's usually a testosterone thing. Also, less sexual desire. In men and women, testosterone is responsible for increased sexual desire. So if testosterone levels start crashing for men, they are going to not really want to have sex as much as they used to. This is normal, okay? Right around here, during all of this hormonal change, this is where you start seeing erectile dysfunction as well, where a man cannot actually get an erection. And this is where you get the little blue pill, the Viagra, whatever. That's going to give a surge of hormones to, for a short period of time, allow a man to have an erection and actually ejaculate baby making stuff. Now, the estrogen is going up as the testosterone goes down. And so that's one of the reasons why men develop men boobies. Okay. So in the later ages, high estrogen tends to develop male boobies. This is why transgender men who are taking estrogen supplements to make themselves appear like women, that's why they actually develop boobies, because it's just accelerating process that men, generally speaking, already undergo um, as part of their life cycle. That when estrogen is high for a man, they develop boobs. That doesn't mean they can actually lactate. So you can never really develop mammary glands inside male boobs to support a baby, but you can make them look bigger. Okay, that's what estrogen's doing here. And this is normal. Now, we didn't talk about menopause, which, you know, ironically, although it says men in it, is actually women's. So this age of when all of those female hormone cycle stuff going on where all the eggs being released and then you have your period. When that stops, that's called menopause for women. So what that means is that they are no longer able to have children. And so there are symptoms of the lack of hormones that happen along the same time. So for women, you get forgetfulness, you get hot flashes, nausea, heart palpitations, irregular periods. Periods start getting irregular and then they cease altogether. The point at which the periods cease altogether and they have been gone for a year, that means you're fully in menopause. Perimenopause is the 5 or 6 years before that when they start getting irregular. You start having what's called vaginal dryness. This is why older women need to use lubricating fluids in order to have sex because their body is not producing enough natural fluids to make sex not painful. Without vaginal fluids, sex can be extremely painful for a woman, and this is why you need to use vaginal lubrication. And finally, joint aches and pains. Now, both men and women experience mood swings, depression, headaches, night sweats, insomnia, weight gain, and bone loss. And this is all due to the hormone shifts. Now, men specifically, when they start experiencing andropause in their 50s and 60s, they have decreased motivation, a lack of focus, low energy. They do not want to go conquer the world anymore like they did when they were 20. You know, they just give them their golf and their TV and they're pretty good. They also begin to experience muscle loss, actively losing their muscle tone. Mild to moderate erectile dysfunction, that means that they cannot get their penis filled, engorged with blood and long enough to impregnate a woman. And again, they also, it says muscle loss twice. One interesting thing is muscle loss actually turns to tendons before it turns to completely useless. And so this is where you get kind of the stringy old man body look, where they just don't have those big squishy muscles anymore because it's been turned to tendon tissue. So that's what happens at the end of the cycle for both male and female. And that's one of the reasons why you see a lot of divorces at, people get in their 50s and 60s. They manage to live together happily for all those years. And then, hey, bam, both of them are depressed. Both of them have mood swings, headaches. They're getting upset. They're having all these horrible things happen. And that is a very big stress on a relationship. And so if people already had relationship problems before this hits, this is, extremely challenging to overcome for any relationship, having both people suffer through these negative side effects. It's pretty easy to be happy in a relationship when both of you are chock full of happy making hormones and everything's great and there's no stress. The relationships really are tested when all of that stuff is taken away and you have the not so fun stuff. Okay, so thanks for listening, and that concludes our section on the male reproductive system.